Simulation in healthcare is a fairly new field, but simulation is not a new innovation at all. Simulation has been used for a long time in aviation, in military, in law enforcement. It's now becoming very popular in homeland security and even in the financial industry. So it's only a matter of healthcare being a responsible industry that we are required to do simulation training for our staff.
Ms. Livingston, do you know where you are?
The clinical side revolves around very high-tech simulators that mimic bodily functions and conditions that might be encountered in the healthcare field.
Hi, can I help you?
Yes, I need help in here now, please.
I'm coming.
We've done simulation with an LDRP staff, which was postpartum hemorrhage, and we had a doctor, we had 4 or 5 nurses participating. We ran it for 10 minutes just to improve a process of how to care for a patient with a postpartum hemorrhage.
After our last simulation that we did, probably 2 weeks after that, we had a true emergency on the unit. Many of those nurses who were taking place in the last simulation that we did were part of this emergency. And it was incredible how fluid everybody became within that emergency. The performance of the group was reflected by that simulation.
We've also ran simulations with the FBI, and that included their EMTs. That was stabbing, shooting, fall victim, and a child that had an anaphylaxis shock.
We're realizing that more and more of our patient safety focus needs to be on how we communicate with our patients, how we communicate with one another.
Ma'am, please
All right, ma'am.
stop.
Listen, try to be calm. I'm gonna
ridiculous.
get him to help you.
We've begun a virtual dementia tour where we take our staff, specifically those involved in direct patient care, and put them through a simulation that mimics what it would be like to experience dementia. So we put headphones on them to obscure their auditory sense. They hear voices, there's background noise. We put goggles that obscure their vision, gloves on that decrease their tactile sense, inserts in their shoes that make it uncomfortable to walk like it might if they had neuropathy. And then we give them instructions, 5 very simple tasks that they need to go into a room and do. And it's very enlightening to them when they realize they're afraid. Simulation is a lot about applying knowledge in an immersive environment.
How's your breathing feel?
And then it's just as much about debriefing and talking about how you might handle that situation differently the next time.
There's some things that you could have done that might help the situation.
Every encounter with our patients could potentially be rehearsed in the simulation lab so that we're saying the right things at the right time. More importantly, we're working together. We've practiced our teamwork. We've discussed with one another how to handle very emergent situations so that it's not something that wasn't planned because we've simulated the emergency that's occurring.